a big piece of it is we're going to start treating the autoimmune condition, which is very important, right? We're going to actually figure out what is causing your immune system to attack the thyroid. There's a reason for it. It doesn't just come out of the blue. There's something that's causing that. I'm Dr. Jacob, an naturopathic medical doctor and integrated physician. And in all this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Make sure to subscribe for more videos like this one. Okay, let's jump in. Yeah, let's talk about Hashimoto's thyroiditis and what it is. So what it is, it's an autoimmune condition of your immune system attacking the thyroid gland. It's different than Graves' disease. That's another autoimmune condition where your immune system attacks the thyroid gland. In Hashimoto's thyroiditis, what happens is it makes your thyroid gland not make T4 very effectively, which is a hormone production. So that's in a nutshell what it is. Immune system is attacking the thyroid, making it not make the thyroid appropriately. And then you're not making enough thyroid. Then you get tired, fatigued, lose your hair, get constipated, cold, dry skin. All these type of symptoms come along with your thyroid not working appropriately. How does the typical MD treat a Hashimoto's patient? First, they need to make the diagnosis. Most of the time, a typical MD doesn't care if you have Hashimoto's or not. So many times they're not even going to order for Hashimoto's. Majority of my patients that have been diagnosed with Hashimoto's found it online that they needed to check it out and get it checked. It's very rare that a conventional doc is going to look for Hashimoto's because they don't treat it. But let's say you go to the MD and they check your TSH, they check your antithyroid peroxidase and thyroglobulin antibodies, and they say, hey, doctor's going to do is not going to care about the autoimmune condition at all. That's just there. And they're just going to give you thyroid hormone. They're going to give you usually T4, which is Synthroid most of the time, or also known as levothyroxine. And that is all they're going to do. And then they're going to keep on monitoring your blood work. They might do it every 6 months to a year, usually every year. They'll see where your levels are at. And they're just going to be checking that TSH, not going to be looking at anything else regarding the thyroid. And if your TSH number is in the appropriate range, they're going to keep you at the dose where you're at. Or if your TSH goes out the range, like it goes too high, they're going to give you some more thyroid hormone. And that is the conventional approach towards treating Hashimoto's thyroiditis. It is you are dependent upon Synthroid your entire life, and your thyroid is going to continue getting worse and worse and worse. And many times you have to take more thyroid and more thyroid because the autoimmune condition isn't being addressed. What does a patient experience when they're doing the conventional approach to Hashimoto's thyroiditis? They are going to probably feel pretty good. They were low on thyroid hormone. So now they're taking thyroid hormone. So they're going to feel more energetic. They might stop losing their hair. They're not as constipated, not as cold as much. Sometimes people have Hashimoto's thyroiditis, but their TSH numbers are normal and they really don't have any symptoms yet. They just have antibodies being produced, but they feel okay. They don't have really any issues yet. So you don't need to get thyroid hormone, and your conventional doc isn't going to give you thyroid hormone. But that's a great time to start treating the autoimmune condition, right? There hasn't been enough trauma to actually decrease thyroid hormone yet. So we need to be working on the autoimmune approach. But if you went to a conventional medical doctor, they're not going to treat that, and they just don't know how to treat Hashimoto's thyroiditis, at least the autoimmune component. What happens to the body if you're just taking T4 from your conventional doctor and you have Hashimoto's thyroiditis? What happens is the immune system's still damaging the thyroid gland, right? It's still gobbling up certain pieces of your thyroid gland, making it more inflamed and more inflamed. So what's going to happen is your thyroid's going to decrease the amount of thyroid it's making over time. And that's why you need to keep on taking more thyroid hormone, is because there's more trauma that keeps on occurring. And then sometimes what you get to a point is like your thyroid hormone isn't doing anything. You really don't feel any benefit from it, or you're just getting side effects from taking way too much thyroid hormone at that point. So really treating the autoimmune condition is very important because you're just not going to be treating the cause. And also what can happen if you have one autoimmune condition, many times you're going to get another one. So Hashimoto's might be the first little trigger, which isn't as bad as some autoimmune conditions. Could be the first trigger that, wow, you really need to get things under control. We need to decrease your inflammatory response. But if you don't, and you're just treating it like the conventional doctor would have just given you the thyroid hormone, your other autoimmune conditions could possibly show up also. We have talked a lot about the conventional approach. Now let's dive into the naturopathic or integrative approach to treating Hashimoto's thyroiditis. So it's completely different than the conventional approach because a big piece of it is we're going to start treating the autoimmune condition, which is very important, right? We're going to actually figure out what is causing your immune system to attack the thyroid. There's a reason for it. It doesn't just come out of the blue. There's something that's causing that. It could be related to chronic infections like Epstein-Barr virus, cytomegalovirus, mycoplasma pneumonia, chronic strep, Lyme disease. Maybe it could be those. It could be a certain food that you're eating, like gluten is very common. The gluten molecule looks a lot like the thyroid molecule and they cross-react with each other. Could be a dairy allergy or it could be any type of allergy. It could possibly be that you have some gut issues going on and causing a dysbiosis, which is an imbalance of your good and bad bacteria. It could be related to exposure to all kinds of different toxins. So if you go to an integrative doctor, they're going to figure out what's going on. They're going to order a lot of different labs. They're going to ask you a lot of different questions to be able to identify the cause. And then once that cause is identified, they put a treatment protocol together to treat that cause. And through treating the cause, that decreases the immunological response and the thyroid gland gets healthier and healthier and healthier. And if you start early enough before you even need to take thyroid hormone, like you're not showing up that your TSH is high or your T4 is low or T3 is low, you can get to a point that maybe you never have to take thyroid hormone ever. But let's say you're already in a place that you already are taking thyroid hormone. You've been doing it for a while for Hashimoto's thyroiditis. There is still hope because it is still very important to decrease that inflammatory response so there's not further damage and further autoimmune conditions don't occur. And also, you're going to feel so much better than just taking thyroid hormone because if you just take thyroid hormone, you're going to get the benefits of the mitochondrial stimulation from the thyroid, but you have all this bogging down and all these inflammatory mediators going on in your body. So many people with Hashimoto's, they might have some sleep issues because inflammation in the brain. They might have some anxiety, depression because of that, or they might have some joint pains, or they might have back pain from an injury, but it could totally go away if you decrease that inflammatory response. So that's a big piece of difference is the naturopathic or integrative approach is going to identify the cause of the autoimmune condition and really go after treating it. And they're going to prescribe treatments that go after the cause, but also they're going to give treatments specifically to decrease that inflammatory response. One therapy that I really like is called low dose naltrexone. We do really low doses. We talked about this in previous episodes about naltrexone. Really high doses, it helps you get off of opiates or whatever. But if you do low, it modulates your immune system. Modulation means you still are able to fight off infection as needed, but if you're making too much inflammation, it will decrease that. And a lot of good research is coming out on low dose naltrexone and treating Hashimoto's thyroiditis. I also like turmeric and boswellia and all kinds of things. They might do it differently. So many times you might not need T4, you might actually need a T4, T3 combo. Maybe you just need T3 by itself. And because a lot of times, if you're just doing T4, you're not converting it to T3, and then you're not even getting the benefits. I mean, I'm sure there's a lot of people listening to this episode that are like, I'm taking T4. I don't really feel any better. And probably a piece of that is that you're not converting it to T3 and you need T3. So yeah, that's a quick overview of how a naturopathic medical doctor might go after Hashimoto's. Yeah. So now let's talk about the financial aspect of conventional care and naturopathic care. So if you go with conventional medicine, many times it's going to be covered by your insurance and it's not going to cost you a lot because your doctor visits are covered by your insurance. And then the drug that you're getting, the Synthroid, is covered by insurance. So it's cheap, right? Doesn't cost you much except insurance isn't cheap. So that's costing you money, but you want to use your insurance. So you're going to the doctor and it's taking care of that. But like we talked about, it's not really treating you well, but it's kind of making you feel a little better, but things are getting worse. So back in the day, I took insurance for a bit, but I stopped taking insurance because it doesn't work with the model of how I treat patients. I spend a lot of time with my patients to really get them, find out the true cause of what's happening. And insurance doesn't work that way. You can't spend a lot of time with the patient because the doctors don't get paid efficiently enough to actually spend that time with all the overhead that they have. So they can't spend a lot of time. They need to be very quick. So that's why a lot of times you go to your conventional doc, it's pretty quick visit because the insurance is doing that. But also the insurance dictates what I do, what I prescribe, what labs I can do, all the treatment that I do. And if I don't do what they have to say, I might be kicked off their insurance. And maybe you probably have experienced this as certain doctors won't, or even order a lab that you ask for. And they won't tell you it's because of insurance, but the big reason is they would love to actually order that for you. But the insurance company won't pay for that, or they might give them a doc if they even order that specific thyroid tested when we're talking about thyroid here. So you're going to be, if you use insurance, you are going to go to a doctor that you're being treated by an insurance company. You're not being treated by a free, open-minded doctor that is doing everything he can to really get you feeling better. So insurance model might be cheap, but you're not going to get the best care. And also you're dependent upon a thyroid medication your entire life, making you dependent on insurance your entire life, or having to pay for a certain medication your entire life. And maybe the insurance decides to stop paying for that medication in the future, which we see all the time. So condition gets worse, might be more expensive in the long run, because if you go to the naturopathic medical approach, maybe more expensive in the beginning, but it's going to probably be much less in the long haul because you're really going to treat the true cause of what's going on. You're not going to have to depend upon a certain medication your entire life. You're not absolutely going to have to depend going to a doctor your entire life because the true cause was fixed, right? So you might have this upfront cost, but in the long run, it's probably going to be cheaper. Treating the symptoms, don't treat the cause. The cause is still hanging out there and everything just keeps on getting worse. If you treat the cause of what's going on, the symptoms aren't going to get worse and you're going to feel 1,000 times better. Yeah. So if you want to see me as your doctor, visit my website, integrativemedica.com, find the phone number there, give my receptionist a call, set up an appointment with me. You could do that virtually or in person. You could also set up an appointment directly from our website. If you want to learn more about Hashimoto's, Graves' disease, or other chronic conditions, click my videos to the right. I'm Dr. Jake, and I'll see you there.